know the instructions. So, all right, so we're going to get started with a review. Now, this is important that you understand. This was set up as like a Family Feud type of game, which was really a lot of fun in class. I divided the class into 2 teams, or 4 teams actually, and then we did like a round robin competition and went over these types of questions. And they had flags because I didn't have buzzers, so they had flags they put up when it was their teams when they were guessing. And it was really kind of fun. But know that you're not going to see a question that looks exactly like the question that I am giving you. So for an example, I'll give you an example of the first one. According to myplate.org, which food groups should make up the majority of calories consumed by a normal adult? So anyone want to answer it for me? So according to myplate.org, which food group should make up the majority of calories consumed by a normal adult? Okay, so we've got veggies. So, and this is where it gets tricky with this type of question because there's so many different trends out there. You know, there's the keto is the new up and coming thing. It used to be Atkins that was crazy. And so, you know, we would have lots of proteins in there. You know, if you're a vegan, you're looking at fruits and vegetables and things like that. But according to myplate.org, it's actually carbohydrates. So you're not going to see that question, but what you're going to have to do, my intent is to draw your study focus to concepts. So between the outline that I've provided for you in this, hopefully it'll draw your attention to the concepts so that you can review and then be able to apply those concepts. The exam questions are the same type you've seen throughout this whole course. They're a majority of them are application, very few of them are recall. If they are recall, you often see them in a SATA, which, you know, raises the level of difficulty with recalling them because you have to be certain it's not just recognition, you have to actually be able to recall it. So that's what this is intended to do. So what I'm going to do, I'm just going to work my way through the questions and we can chat in if you want. And then we'll get everything covered that way. Okay, so our next question is, what is the purpose of corticosteroid medications to treat asthma?
Reduce inflammation?
Yeah, so we're decreasing inflammation so we're decreasing that inflammatory response to the triggers. So, but decreasing inflammation, absolutely. So good. All right, our next one. What are the signs of a blood product transfusion reaction?
Fever.
Fever, but not just fever. How much of a fever? It's very specific.
2.
Fever of 2 degrees. Yeah, 2 degrees or more. Absolutely. And so some of the other back pain. So yeah, that low back pain, flank pain, particularly specifically. What else might we see? Anxiety. Yes, absolutely.
Would skin be flushed?
It could be, yeah. Or you could actually might even see a rash with it. You might see a rash. There could be some itching and some dyspnea. So good. All right, we'll move on to our next one. We covered most of the key points there. What is the normal range, or what is the range for normal BMI?
Fifteen and a half to 24.5, I think, or 24.9.
24.9. Excellent. So good. So if you'd have been on that one, you would have been the fast draw and got the points for your team for that. All right.
I'm sorry. What was the answer to that one?
18.5 to 24.9. And it's in the recorded lecture and the live lecture from yesterday. So it's all right in there for you. All right. Name a symptom of worsening left-sided heart failure. So what are we going to see? What clinical manifestation would you see with worsening left-sided heart failure? Okay, crackles. Yeah, absolutely. You could hear some crackles. And dyspnea, yeah. The dyspnea is the big thing. You're going to see that increased shortness of breath. And then what else are we going to see with that? What is like our number one teaching point for people with heart failure to monitor how they're doing? What are they supposed to do every day?
Daily weights.
Daily weights, right. So we're going to see weight gain. So the increased dyspnea and the weight gain are the main ones. Absolutely. You might see edema, you might not with left-sided heart failure. It depends on whether the right side is getting impacted with as well. All right. Normal potassium levels.
3.5 to 5.0.
Thank you very much. That's correct. All right. A person with Graves' disease is more likely to be overweight or underweight.
Underweight.
Underweight is correct. Good. What dietary restriction should be recommended for a client with hypertension?
Low sodium.
Yep.
So
Excellent. You guys are awesome. I love that you're chatting in. Makes it more interesting. It's not just my voice we're hearing. So good. A person with epilepsy who is experiencing jerking of all extremities is having what type of a seizure?
the tonic clonic.
Yes. So we've got people chatting in too. So tonic-clonic seizure is correct for that. Good. Which action is most important to reduce the transmission of infection?
Wash
Hand
your
wash.
hands.
That's right. Hand hygiene. All right. List 3 signs of peripheral artery disease. So I'm taking you back towards the beginning of the program. 3 signs of peripheral artery disease.
Is edema one of them?
Not necessarily. No. Remember there were 6 P's. So hairless, okay. Shiny skin. Okay. Yeah, so look up those pain, pallor, there we go, paresthesis. Look up those 6 P's. You'll want to know that. All right. Which medications would be administered to a client with status epilepticus? Okay, so diazepam, definitely. So we're looking at benzodiazepines. So diazepam is one of them, but what other benzodiazepine would they give during the actual seizure? So I'm seeing Dilantin come in here. Remember Dilantin, they'll give Dilantin. Dilantin prevents seizures, but it doesn't stop them necessarily while they're happening. So lorazepam, good. So lorazepam or diazepam, either one, during status epilepticus. All right. List 2 findings that would suggest an allergic reaction. Hives, good. All right, so rash, swelling. Swelling in particular, what's most concerning when it starts to swell? The tongue, yeah. Swelling of, yeah, we get really concerned there. Dyspnea, good. You got the itching. All right, and then that swelling of the tongue, which can lead not just the tongue swelling, but we can get that constricted airway with the edema of the airway. Okay, good. List 3 foods that are high in iron.
Spinach.
Red meat mostly. Fish might have some iron, but that's not usually when we're advising patients to increase.
Spinach.
Spinach, yeah. So red meats like beef, spinach, green leafy vegetables, good.
Beans?
Lentils.
Yeah,
Like beans.
beans, lentils. Good, good. You know, and keep in mind also your whole grains and even some fortified cereals can be high in iron because they're fortified. So good. All right. A person with a cervical spine injury is at risk for which fatal complication?
Respiratory distress.
Yes, respiratory distress or respiratory arrest. Good. All right. Is the weakness and paresthesia that's associated with Guillain-Barré ascending or descending?
Descending?
Descending.
Yes, it is ascending. Very good. All right. A client who is hyperventilating would be most likely to have
Sorry
which
to interrupt. Dawn,
AB
what was the Guillain-Barré? What was the question again?
is the weakness and paresthesia associated with it, is it ascending or descending? So in other words, does it start at the feet and move up towards the head, or does it start at the head and move towards the feet? And so ascending, meaning it starts at the bottom and moves up. So that's the correct answer.
Thank you.
Sure. Okay, so a client who is hyperventilating would most likely have which ABG diagnosis? They're hyperventilating. Respiratory alkalosis. Good. Somebody, Courtney chatted that in for us. Good. Respiratory alkalosis. Why are ketones absent with HHNS or HHNK? It's not because of the osmolarity. Does anybody recall that? It was a couple weeks ago. I know your brains are on overload. All right, I'm going to give you the answer. The answer is because insulin is still produced with type 2 diabetes. So you see HHNS in type 2 diabetes. You don't see it in type 1 diabetes. And the pancreas is still producing insulin, which prevents those ketones from developing. All right. Severe diarrhea can lead to which electrolyte imbalance?
Potassium.
What about it?
We'd be low potassium.
Yes. Good. Good.
Hypokalemias.
Yep, hypokalemia. So pay attention to your questions. If it's asking about an electrolyte imbalance, we're not talking about ABGs. You know, so keep that in mind. There's a difference between ABGs and electrolytes. So pay close attention to that with your questions. A patient with an NG to low intermittent suction would be at risk for which ABG diagnosis? So they have an NG to low intermittent suction. I see.
Hypokalemic? Oh, no, you said ABGs. Never mind.
Yep, ABG. Okay. I'm seeing, Courtney, did you chat in on this one or was that from the previous question?
But that is the answer, isn't it?
It is. It's
Okay,
the answer.
awesome.
I wanted to make sure though, which one, because somebody else chatted the same thing.
Well, it says
Stephanie.
9:15. Got a time stamp on there.
True. All right. So the correct answer is metabolic alkalosis. Okay, good. All right. A client experiences progressive muscle weakness that worsens with repetitive use. They also have unilateral ptosis and mild diplopia. Which condition is suspected? So we've got progressive muscle weakness that worsens with repetitive use, unilateral ptosis, that's PTOSIS, and mild diplopia. It's not MS. This is a harder one.
Yeah.
It's the myasthenia gravis.
Yes, it is.
Yeah.
Well done. Well done. All
Go,
right.
Angela.
Go, Angela.
Got one right.
Which vital sign may be abnormal in a client with hypothyroidism? Which vital sign will be abnormal with hypothyroidism? Maybe. Not always, but maybe.
Low
Low
heart rate.
All right. So the heart rate, are we going to see the heart rate increased or decreased?
Oh,
Decreased. Good. There was some competing responses. So good. Decreased. Which medication should be given immediately to a client with a new spinal cord injury?
Say that again.
Which medication should be given immediately to a client with a new spinal cord injury?
Oh, that's the 8-hour one. It is called methylprednisolone.
Okay, so
Mhm.
pretty close. Salumedrol is the trade name for it. It's methylprednisolone. So salumedrol, yeah. So it's an IV corticosteroid. Good. All right.
And that's to decrease the inflammation so that there's no more pressure on that nerve.
Yes.
Okay.
Yes.
We were trying to
Absolutely.
figure that out last night, and we thought that's what it was, but we weren't
Yep.
positive.
Yep. Good.
All right.
Good. A client with diabetic ketoacidosis, so DKA, would most likely have which ABG diagnosis?
acidosis.
Good.
Yep.
Good. All right. List 3 findings indicating that a client has DKA. So what are the clinical manifestations of DKA?
Ketones or protein in the urine, or is it ketones?
Okay.
Ketones and
Ketones.
then 300. Is it 300 blood sugar?
Greater than 300 blood sugar, correct?
Decreased respirations.
Okay, not just decreased, that is correct. But,
Right.
well,
But almost.
actually, it's not decreased.
Well,
It's not decreased.
they're not
Pause the mouth.
inhaling as
Too small. Yeah,
Too small.
the breathing. So they're kind of rapid. They actually are kind
rapid,
of
but
rapid.
not getting oxygen.
Not effective. Yeah, they're trying to blow off
Right.
some. Yep. Okay. Good. What else are we going to see? I got to look at the chats here. I'm missing some of them. Fruity breath. Good. So we've got that acetone kind of breath. It's pretty pronounced too. If you haven't smelled it, has a distinct smell.
Don't they have tachycardia?
They can have tachycardia. Yes, not always, but they can. Don't forget the polys. What are our polys with DKA?
Polydipsia,
Polyphagia, polyuria.
Good. Good. All right, we got it. All right. What is the first action that should be taken if a client experiences autonomic dysreflexia? First action.
Sit the patient up 30 degrees.
Good. That is correct. All right. Spinal cord injuries above this level can lead to loss of respiratory function.
C4.
Okay. According to our resources, we have C3. So just start a C3 in your brain. Okay.
Yeah.
Okay.
So it's right around there. You know, but C3 definitely. Okay.
C3. Okay.
A client with an exacerbation of COPD would have which ABG diagnosis? COPD.
Respiratory acidosis.
Yep.
Good. Good. All right. Let's see, where are we here? Blood glucose levels should not be decreased by more than how many milligrams per deciliter per hour? So we're talking about someone maybe with DKA and we're trying to bring their blood sugars down. What's the most we should bring it down per hour?
Is it 10?
Not 10. Oh, somebody chatted it in here. 100 is correct. So no more than 100 an hour. What's the risk what can happen if we bring it down faster than that? Does anybody recall?
Cerebral edema.
Yes, thank you. Good. It can lead to cerebral edema, which is the leading cause of death for people with DKA. All right. Normal hourly urine output is required before administering potassium. How much is required
30.
per hour? 30. Good. Good. What position will a client in respiratory distress naturally assume?
Tripod.
Tripod.
Good. Which medications are prescribed to treat chronic gout? We just had this on the
Allopurinol.
test. Allopurinol. Uloric. Okay. One other one so probenecid is the other one. Okay, so allopurinol, it's febuostat or febuxostat. I don't even know how to pronounce it. I'm stumbling over it myself. Uloric is the trade name for it, which I don't know that I've ever even seen that drug, to be honest. It's the allopurinol and the probenecid that you're actually going to see in practice. Okay, so make sure you're reviewing those meds for chronic gout and acute gout. Which life-threatening condition is a hypersensitivity to ACE inhibitors? Which life-threatening condition is a hypersensitivity to ACE inhibitors? It's not the most common sensitivity or reaction, but it's the most life-threatening to ACE inhibitors. Angioedema, good. Got somebody, well done. Identify 3 strategies to prevent the transmission of HIV.
Standard precautions.
Okay, good. Standard precautions is one, probably the most important. Well, they're all important. If you
Don't share needles.
don't share needles, good. Okay, and safe sex practices. So we'll accept that, but remember that it's technically to prevent it. Abstinence is really the only true prevention because we know that condoms, which are often used as a precautionary intervention with sex with people who have HIV, we know that they're not 100% effective in preventing conception. So you can't totally trust them to prevent infection transmission either. So just keep that in mind. All right, what condition associated with rheumatoid arthritis can affect visual acuity? We just had that. Sjogren's, good. So Sjogren's syndrome. All right, we have a client with COPD they develop core pulmonol. What are some expected findings with core pulmonol? Or clinical manifestations, if you prefer that wording. Okay, I'm going to assume you meant JVD, so jugular vein distension. Good.
And that would be considered right-sided heart failure, correct?
Yes, yes. So core pulmonol is synonymous with right-sided heart failure. So edema, so we're going to see some peripheral edema. Where else will we see that edema? We call it something different, but it's essentially the same thing that goes not in your ankle, legs, or whatever. So,
Peripheral.
okay, so there's peripheral edema. Where else may a person who has this accumulate fluid? Not the lungs. So don't get confused by this. Left-sided heart failure, it's going to back up in the lungs. Right-sided heart failure, it's not going to get to the lungs because the right side of the heart can't pump it efficiently in there. So the abdomen, yeah, we're going to see some ascites or increased abdominal girth with that. All right, but then what, you know, the patient teaching for monitoring this for left-sided and right-sided heart failure are the same. So what do we tell our patients to do?
Weigh yourself.
Weigh yourself. So weight gain is something that we'll see for both, but be able to know the difference between the left-sided and the heart and left-sided and right-sided manifestations. Weight gain is the same, but where that fluid accumulates is different depending on what part of the heart is not functioning. If the left side is not functioning, it's going to back up in the lungs. If the right side is not functioning, it doesn't get to the lungs, so it backs up into the jugular vein and into the abdomen and to the periphery. Okay. All right. Monoclonal antibody biologic drugs. Okay, so they're MABs, they're called. Monoclonal antibody biologic drugs that are used for autoimmune diseases have what effect on the immune system?
Suppresses.
Okay. It suppresses the immune system, and that's really important. So the things you've got to think about, the two main overall concepts is we need to protect them from getting infected. So that's the first thing. So prevention, telling them to stay away from crowds, wearing masks, we're all used to that right now, preventing infection. But then also that early detection of signs and symptoms. So make sure that they know that if they do start to have signs and symptoms of an infection, that they seek care right away to get help, because often they can't fight it off on their own. So immunosuppression with the drugs, the monoclonal antibody biologic drugs used for autoimmune diseases. Name a strategy for health maintenance for a client with systemic lupus erythematosus, or lupus is what we usually call it.
Stay out of the sun.
Yeah,
Sunscreen.
Good. Avoid sun exposure, wear sunscreen. What else? Okay, skin care. So that's a part of it. Yep.
Dietary restrictions, but I don't remember what they are.
Okay.
It's potassium. Aren't you supposed to stay away from potassium?
Well, possibly. And what organ system is affected by this disease that often is the reason that they stay away from potassium? What organ system can be impacted?
Kidney, liver, and heart.
Yeah, but the kidneys in particular are in.
Yeah.
Yeah, renal impairment is a pretty common side effect for this. And so that's usually the reason. If they're on a potassium restriction, it's usually because they have that renal involvement. Okay. So remember that these people still need to exercise, but they need to rest when needed. So they can still exercise. They just shouldn't do excessive, they shouldn't be out doing marathons and things like that. But they do need to be physically active, but they do need to rest as they're needed to balance that. So it's challenging for individuals who have that disease to manage it sometimes. Okay, 3 expected findings in a client with COPD.
Barrel chest.
Good.
Thin.
Thin.
Mm.
Some, not always. Sometimes.
They're always tired. They're always tired because they have such a high dry. They're trying to breathe.
Yeah, the work of breathing takes a lot of effort. So the fatigue.
Pallor.
Clubbed fingers, I see that. Yeah, we see patients who are in the 50-50. So we have that lower baseline O2 sat is pretty normal. We can see malnutrition, and usually we see that because the work of eating is so hard for them. We see that in later stages of COPD with the malnutrition. They can't be off their oxygen long enough to take in the amount of nutrition that they need. So yeah, we want to give those small, frequent meals. Absolutely. And then remember that the expiratory phase is longer than inspiratory. So that's not normal for a normal person, but with someone with COPD, the expiratory phase is longer than the inspiratory. Okay, good. So which medications are used to treat acute gout?
Colchicine.
Colchicine is one. Yeah. Endomethacin, good. So NSAIDs, so indomethacins or ibuprofen. But remember the indomethacin is one of your NSAIDs. All right. Which organ system, oh, we already talked about this, which is affected in clients with lupus. And we talked about the kidneys. Yep, we did that already. Good. All right. So we're talking about patients who have Parkinson's disease. How would you document a rhythmic interruption of muscle movement in a client who has Parkinson's?
Oh, would that be cogwheel?
It is cogwheel. Yep. Yep. So cogwheel. So think about a cogwheel that's going. So they get this jerky movement. So it's a rhythmic interruption of muscle movement. All right. What about if they have mildly restrictive movement? What would we call that?
Lead pipe?
Mildly restrictive.
Plastic?
Plastic for mild restrictions. So think about a piece of plastic that'll actually bend. Compared to something that has total resistance to movement, we call that's the lead pipe. Yes. So think about, you can't really bend a lead pipe, but if you had a certain type of plastic, obviously there are some types of plastics you couldn't bend, but if it helps you to remember it, think plastic can be bendable. Lead pipes are never bendable. And then the cogwheel. Okay, we're moving along here. We're about almost halfway done. Name 2 client teachings for a client with Raynaud's disease. Gloves outside, good. During cool weather in particular.
To lie flat? No.
Not necessarily.
No.
Avoid caffeine, good. Yeah,
Caffeine,
avoid
sure.
all kinds of caffeine. So we're wearing gloves out.
Quick question about that. They don't need to worry about heat though, right? Like that their hands.
Not usually.
Not usually, because I don't remember that was a question, and I like went back and forth.
Yeah, well,
no.
actually, they do have a loss of sensation. So if they're going to be handling hot objects, they should probably have gloves, be extra careful with that. So the cold weather, whether it's gloves or extra socks outside, that's because it causes the vasoconstriction and can exacerbate the condition. But they might need to wear gloves for handling hot objects. Yes.
Okay. Thanks.
Okay. Yes, absolutely. All right. When does Lispro insulin peak?
Is that 4 to 6?
No,
Oh.
Is it a half hour to 2.5?
that is correct.
Ooh, I was way off.
That's okay. So make sure you review those because you don't. This is the idea behind this. I brought up Lispro, but that doesn't mean Lispro is on the test. Any of them could be on the test. So make sure you're spend a little bit of time reviewing those peaks. This is when you need to check on your patients, is when the insulin is going to peak. Which oral diabetes medication must be held after receiving IV contrast?
Metformin.
Correct.
Yep.
Good. When does NPH peak?
Six to 12? Do I have that way off? Hold on.
You know what? I actually do not think I updated this specific resource. So I'm going to pull up the resource that I gave all of you and make sure it is updated on this resource before I answer you, because it did change. All right.
Yeah, it's 12.
Regular, so
Or did you say NPH?
NPH is 6 to 12. Correct.
Yeah. Okay.
All right. And then what about the regular insulin while we're right here?
Two to three. 2 to 3.
We have 1 to 5 is on
Oh.
the table that we have. So, and there's such a variance actually in real life. There's quite a bit of variance.
Are
So,
we using table 57-4?
I'm using a table that I provided in the Blackboard resources that was updated on 6/5 of 2020.
Okay.
So it's in module 7
Yeah.
in Blackboard. You should look at that and then just look at the peak and that should set you up fine. Okay, I just made a note to update this. So thank you for letting me pause to do that. Okay, which 2 medications are in the Advair disc and how does each work? So what are the 2 medications in the Advair discus? And how does each one work?
I know one is a steroid
Okay.
and it decreases inflammation, but I forgot what the other one was.
Okay, so that would be the fluticasone. Good. Thank you, Courtney. That's your fluticasone. And what is the other medication?
There's a bronchodilator in it, salmeterol or
Yeah, salmeterol. Yep, salmeterol, which is a bronchodilator. Good. We got there. Team effort. All right. Name 2 strategies for a client with AIDS who's struggling to maintain a healthy weight.
Edible marijuana.
Yeah.
Okay, there we go. It's not on my list, but that is truth.
Isn't
It
it
is true.
small, frequent meals high in protein?
Small, frequent meals. Good. Good. Small, frequent meals. High calorie, but not high fat. Okay. What else can we do to help them?
You can give a supplement like the magic cups or, right?
Okay, so are you talking about the
Sure.
magic mouthwash?
No, magic cup is just like, it's like Ensure. It's just
Oh,
called,
okay.
at our work, it's called a magic cup. It's just high in calories and high in protein.
Okay, sure.
It's ice cream.
Oh, yum. That'd be better than Ensure, in my opinion. Okay, so what else can we do? Remember, they often have sores in their mouth. So how can we help with that?
Sucrafate.
Soft food? I don't know.
So all of yes to the soft food, but just doing regular oral care, frequent oral hygiene. Yeah, very important. Don't forget the basics. Keeping their teeth clean and freshening up their mouth before they eat can really help them. And there is something called a miracle mouthwash that it's a prescription of a combination of things that I think it has some lidocaine in it that'll actually numb it. So if the sores are, this is for people who have cancer as well as people, or not chemotherapy, as well as people with AIDS. That could be helpful for them. And then don't forget about our interprofessional collaboration with our dietitians. So they can, meet with a dietitian would be good too. Okay, good. 3 clinical manifestations of tuberculosis.
Night sweats.
Cough.
Night sweats, cough. Good.
Yeah.
What else?
Fever.
Fever. Low grade fever.
Sanguinous sputum.
Yeah. Yep. sanguinous or blood in the sputum. Good. And what else do we see often?
Weight loss?
Yes, that's the last one. Well done.
Huh?
All right. What is our normal range for hemoglobin A1C?
4 to 6%.
4 to 6. Good. 4 to 6% is normal. All right. What intervention can be used to quickly lower potassium levels?
Insulin.
Insulin and what? Two things together?
Normal saline.
No. So K-exalate won't do it as quick. K-exalate is more permanent because we actually excrete the potassium out. But how does the insulin work? How does it help?
Does it have anything to do with bicarb?
Nope.
Okay.
So how does the insulin lower the potassium?
It pulls it out of. It pulls it from one
Intracellular.
place, put it into another place.
Intracellular to extracellular.
Okay, but how does it get there?
It pulls it from higher to lower.
Mm-mm.
Whatever.
Nope. It's important because if you don't get the second part of this answer of what you need to quickly lower those levels, you don't have, it moves with the glucose. Good.
Yeah.
Thank you, Stephanie. So you have to have IV dextrose with the insulin unless someone is already hyperglycemic. So it's like someone with DKA, they've got super high glucose levels. So we wouldn't want to give them more glucose. But an average person who has, normal or close to normal glucose levels, we would want to give the IV dextrose along with the IV insulin. And then that causes the insulin will drive the glucose into the cells and it takes the potassium with it. All right. When does Lantus peak? It doesn't. Good. Thank you. Very good. Lantus does not have a peak. All right. Which lab values should a nurse monitor for a client on an insulin drip? So we're going to monitor potassium. What else do we need to monitor regularly?
Blood glucose.
Yes. Don't forget that. And how much? What's the most we should lower in an hour?
100.
Excellent. Thank you. How can a client with a gastric bypass avoid dumping syndrome?
High protein.
Okay,
Eating
so
small meals.
smaller meals and choosing protein, that's good, over what? What? Avoid fluid when eating. It's kind of hard to avoid fluid when drinking. I'm sorry, I had to tease you.
We knew what you meant, Stephanie. It's okay.
I know what you meant too, but I had to tease. I know you're a good sport. So yes, no high sugar meals. So avoiding concentrated sweets. So very good. Very good. And then eating slowly, avoiding drinking a lot with the meal. All of those things help with that. Excellent. All right, let's see. Name 3 clinical findings in a client with Graves' disease.
Bulging eyes.
Okay. Weight loss, I see that in there. Good. They might feel warm. Mm-hmm.
Dry.
The cold temperature is usually affecting people with hypothyroidism. So remember, Graves' disease is hyperthyroidism. So you might see a goiter. Good. Vital signs. What are we going to see vital signs? Tachycardia. Good. And then what about labs?
labs is going to have a low TSH and a high T4?
Yes, they are. Excellent. All right, we got all of that. And we'll move on to our, keep going here. Which lab
I thought you were
value?
going to say double jeopardy.
I know I'm going to have to take this review to a different format because we're online again next quarter and it's boring. I got to figure out a new strategy to make this fun and interactive than what we're doing now. I'm not sure what it's going to be, but I've got to do some investigating because.
This is very helpful, though.
Oh, I know it's helpful, but it's
Yeah.
not as fun as a game. I can do Kahoots. There's a lot of questions to set up a Kahoot, and I think Kahoots might limit how many questions I can have in it. All right, which lab values would be expected with a client with hypothyroidism? Okay, so we're going to see a low T4, definitely, and high TSH. Good. Thank you for my chatters. Which abnormal electrolyte is detected by a positive Chaustex sign? Which abnormal?
Hypercalcemia or
Say it again for me.
is that hypernatremia or calcemia?
Okay, so calcemia is correct, but which one? Hyper or hypo?
Hypocalcemia.
Hypocalcemia. Good. Good. Which laboratory value is elevated with polycythemia vera? Taking you way back. RBCs, good. Yeah, we're going to see with any kind of polycythemia, we're going to see elevated RBCs, red blood cells. Okay. Polycythemia vera is a condition that is a bone marrow disorder. Okay. So in comparison, polycythemia noted in COPD is due to what condition? So polycythemia noted in COPD is due to what condition that's happening? It's a chronic condition.
Hypoxia?
Okay, yeah. So hypoxia. So it's really prolonged tissue ischemia, but that's a result of hypoxia. So having this prolonged lower levels of oxygen, the brain senses that, the monitors in the brain, and so then the brain sends a message. It's a roundabout way, but eventually it gets to, it goes to the kidneys and then it ends up in the bone marrow and tells the bone marrow, okay, you got to make more red blood cells because we obviously don't have enough because we don't have enough oxygen circulating. But in reality, they have enough oxygen circulating or they have enough red blood cells. It's an air exchange problem in the lungs, but the brain isn't able to, for some reason, make that figure that out. So it tells the bone marrow to make more. So there's polycythemia that's due to COPD that's due to prolonged tissue ischemia, and then polycythemia vera is a blood marrow disorder.
Right.
Okay, so.
And with the COPD, they have elevated numbers of juvenile red blood cells.
Perhaps. I don't want to say yes to that. I'd have to dive a little
Is
deeper
that
into
another
that.
condition where you've got high juveniles? Is that leukemia? Yeah, leukemia.
Well, and that's
Or
white blood cells.
erythematosus. Yeah.
Yeah, and the leukemia would be the white blood cells. So.
Neutrophils. Right.
Yep. Okay. What teaching should be included when prescribing levothyroxine or Synthroid?
Weight. changes, weight changes.
So this is teaching. So we're doing teaching on someone who's,
It has to be before you, right? Real. Is that the one you take?
Before you eat, an hour before,
Before you eat.
and no
So-
calcium.
okay, good. So taking it on an empty stomach, wait
Right.
30 to 60 minutes before eating or drinking, particularly avoiding calcium.
Yeah.
And then what else do they need to do regularly?
Weigh themselves.
Not necessarily weigh themselves. We're
They
usually
have
more
their-
worried about the weight with people who have hyperthyroidism because they can get too low. Usually people who have hypothyroidism are often overweight and they're going to be happy to be losing weight. So
They need to have their therapeutic levels drawn.
yeah, they need
Yeah.
to have their TSH levels checked regularly. So, and depending on where they are and becoming therapeutic, you know, initially, if they're initially diagnosed, they're probably going to check it every 4 to 6 weeks until they establish a therapeutic level. Then they may go to 6 months or even annually. All right. What's the normal value for INR?
.8 to 1.1.
Yes, that's the exact range. And so just keep in mind it's right around 1 and it's a really narrow window. So remember that. So 0.8 to 1.1. What's the range for normal platelet counts? (150 to 400) is what
400,
she.
yeah.
Yeah, let me look. I'm going to just double check our little sheet that we have just to make sure that they didn't update that and I didn't update my resource. Yep, 150 to 400. So I do have that correct. Just because somebody chatted in 450, I wanted to verify that my source was correct. So 150 to 400. So when can spontaneous bleeding occur? When platelets get below what level?
$770.
So below 100, we get really concerned, but spontaneous bleeding won't occur below 100. And how low does it have to be before people can just, without any injury at all, they can just start bleeding?
I thought it was below 70.
Taking you back.
9 comes to mind. 90.
It's actually 20.
20. Oh wow, that
Yes.
low.
Yep,
Wow.
that low. But see, this is where patients who have cancer, who have low dropping platelet counts, and when they go on comfort measures and we're no longer replacing platelets, their actual end of life can be pretty traumatic because they can just, without any injury at all, they can just start bleeding. And so they'll have GI bleeds, they'll be throwing up blood during their last hours of life. And it's pretty traumatic for them as well as their family members when that happens. So below 20, spontaneous bleeding can occur. All right. What is the normal range for WBCs? Five to 10,000. Yep, and that's 5 to 10,000. But you often will see it written as 5 to 10 in your lab results. So good. All right. What normal electrolyte level would warrant client monitoring by electrocardiography or ECG? What abnormal electrolyte level? So potassium is 1.
Right.
What other electrolyte?
Sodium.
Magnesium. So
Magnesium.
the big ones are potassium and magnesium. Sometimes calcium if it's super, super off, but always potassium and mag if they are abnormal. We want to keep a close eye on their ECG or telemetry. Which abnormal electrolyte is most likely to lead to an altered level of consciousness? Good. Sodium. Yep. Excellent. All right. What treatments are needed for a client in a sickle cell crisis?
Pain management,
Okay.
transfusion,
Possibly a transfusion. Fluids, so hydration.
Yep.
And oxygen. Yeah. So hydration, oxygen, and pain management. And they may need a blood transfusion, possibly. And yeah, they do need to rest. They get very tired. What medications are prescribed for a client with Meniere's disease?
I'm sorry, what was that question again, Don? I'm sorry.
What medications are prescribed for a client with Meniere's disease? So, well, they might give meclizine. That's for motion sickness. Same with the promethazine. It's the nausea and the motion sickness. But there's a couple other things that are more diuretics. So good. So we're looking at a low dose diuretic. So it could be hydrochlorothiazide, could be Lasix, could be Bumex, depending on the patient. What else might we? Antihistamines. So yes, so decongestants or antihistamines. And then they might actually put what inside the tympanic membrane. What might we give? Does anybody recall? If they're suspecting an infection, does that help? I'm coaching you along.
antibiotic.
Yeah, so they might do some intratympanic antibiotics. So good, good. The diuretic is the big one, and then sometimes the decongestant also. But they do sometimes, those of you who mentioned the antiemetics or the motion for motion sickness, they do sometimes prescribe those as well. All right. So what diet is prescribed for a client with Meniere's disease?
Low sodium.
Yeah, we're going to have low sodium. Okay. Which vitamins are fat soluble?
ACE or ACD and K, right?
Not all of those. Okay, Stephanie just got it in here for us.
ADEK.
ADEK. ADEK. So remember ADEK. All
Yep.
right, and our last question. Which activities can increase intraocular pressure?
Bending over.
Yes.
Coughing.
Coughing.
Straining.
Yep. So pushing to poop. Absolutely. Lifting over 10 pounds. Good. What else do we have here?
Elevated feet.
So it's really about where the head is positioned. So keeping that head in a dependent position can actually raise it. So if your head is below your feet, then yes, that would be.
Yeah, that's what I meant. Yeah.
Yep. So, but it could be just below the waist. You know, they could just be bent over, like we mentioned, the bending over, or even maybe they're not bent over. Maybe they're sitting with their head on their knees, and it's still, that could be a problem. All right. Sneezing and sex, absolutely. So sexual intercourse, particularly, it says. And I think we covered them all. We got it. Well done.
Rock stars.
You are rock stars. So, all right. What other questions do you have for me before I let you be?
I do have one question. I noticed and I don't have it in front of me right now, but I did notice a discrepancy for, I believe it was module 9 on our syllabus. It says, I want to say 41 through 44 chapters to read, but then when we go into module 9, it gives talking points for 41, 46, 47, 48, something like that, I believe. Does anyone else remember that? No?
So these are the, I'm going to go into the module and take a look just so I think I know what you're talking about. So I'll investigate that and I will add it to our frequently asked questions today. I'll be sending that out early this afternoon.
Yeah, I just want to know which ones we really needed to focus on in order to study.
Sure. So the chapter key points have 46, 7, 8, and then 41, but your lesson content says 41 to 44. Very interesting. Thank you for drawing my attention to that. So I will see if there was a reason. Yeah, that's really strange.
It is strange because in your last lectures, you're pointing us towards tables like 44.3. So I'm like, okay, maybe it is chapter 44. So I'm really conflicted on what, you know what I'm saying?
Yep. Absolutely. So I will look into that and clarify that, and we'll get that cleaned up. So thank you for being my QC person. I can't believe someone hasn't brought this to my attention already, because this isn't the first quarter I've used those chapter key points. So I will look into it.
I'm paying a little bit more attention with my second go around.
Well, thank you. I'm most appreciative for your feedback, because I want stuff to I don't want it to be confusing. So if there are things that are leaving you pondering, what's the intent here, I want to clean that up. You've got enough things to worry about that. This recording will be posted once WebEx releases it to me. So it takes them a little time, and it's been taking a little longer. Yesterday's recording from the morning class didn't get sent to me until during the night. So as soon as I get it, I will check tomorrow morning. And if, I'll check before I go to bed tonight to see if it's out there. And if not, I'll check in the morning when I get up, and I'll get it posted as soon as I can for everybody. So one of the questions was answered in the chat, but I'm going to, in case people aren't looking at the chat, about 1/3 of the test is going to be on modules 9 and 10. And then the rest of it will be on modules 1 through 8. There are 10% SATA questions, which means there will be 10 SATA questions for this exam. There are also 4 dose calculations as part of this. Yep.
Do you usually have a pretty good turnout on the final grades? Because I'm nervous.
Everybody takes it. Is that what you mean by a turnout?
No, like, do a lot of people do well in the final?
I'm sorry. I'm feeling a little it's Friday, it's the end of the week. I'm feeling like laughing today.
It's not Friday next week.
I know. Next week, Friday, it'll be super fun, hopefully for everyone. So it just depends, and sometimes I'm surprised. Sometimes students who've done well throughout the quarter, they kind of lax off at the end and don't prepare as well as they should have. And then I'm shocked when I see a lower score than I expect. Other students who've been struggling all along are starting to figure it out as they go, and they do really well on the final. So it's really been hard to predict. Typically my third exam has the best scores on it. Typically, but not always, and not for every student and not for every class. So it's rare to have someone really bomb the final, but people do sometimes fail the final because various reasons, whether they didn't prepare or maybe they're still struggling to navigate the questions, which, that's a journey in itself, learning how to read this. And, I've said this several times this quarter. If you have an hour, I can't stress enough how valuable doing that test question dissection yes presentation that's in supplemental course documents. It's really good. But when you do,
I watched it yesterday and it's amazing. It like light bulbs were going off in my head.
yes, but
Yeah.
this is the key. It's good to watch it. It's good to take that hour to watch it, but then you've got to practice it. So then take questions every day. And it doesn't matter. You're preparing that video is going to help you for every class.
Like, why didn't they give this to us at the beginning of the nursing?
Well, I just got it last quarter.
Yeah.
That was my first exposure to it. So I have a feeling that we'll be introducing it. Hopefully other faculty will introduce it. I'm actually going to use it as part of my first day of lecture. I'm gonna not use her recording. I'm gonna do it myself, but I'm gonna use her PowerPoint, and I'm gonna include it in the first day because I really think for some students, they've been able to manage life and their work commitments and their family commitments and the academic requirements. They've been doing pretty well, but this quarter requires a lot more time. I don't know if that was your experience, but that's what I have observed. And so for some students, readjusting their priorities and how they allocate their time sometimes has to happen during this quarter. And so that's a change some students need to make. Some students I know just have to learn how to study differently because you're studying for application, not just memorizing and recalling it. You have to apply it. And so learning that new strategy. And so once they've made that transition, they do well. For others, it's test taking. It's learning how to take those exams. And so everyone's journey and what they need is a little different. And I mentioned yesterday, somebody had asked about, is PN3 this hard? And PN3 is just as hard as PN2. But what I have found is when students successfully complete PN2 and they start to figure out everything I just talked about with their time management, how they prepare and how they navigate the exams, they do fine. They still have to work hard. They have to work just as hard, but and for some students, just that first exam and not being prepared for it. I know when I was a student, that very first exam, like, I'll prepare for it. But, once I take the first one, then I'll know what the instructor wants and I'll do fine. And that strategy worked a lot for me until I got to my nursing classes, because there aren't that many exams. So if you really get a low score on one exam, it can derail you. And so even if you figure it out later on, sometimes students don't make it through the course successfully and they need to repeat it. And so I'm sad for students when that happens, but I can tell you, I can't tell you how many quarters students come to me who have taken it a second time and tell me they got so much more out of it. Even using the word thankful that they had to repeat it, they feel better prepared to be a nurse, better prepared to move on to the last quarter. I know financially it's a burden, and that's my biggest thing. The time for all of you is a factor, but the financial burden is there, and I respect that. But it's really important that we know that you can provide that safe, competent care, and it's a journey to get there. And everyone's journey looks a little different. And so, be kind to yourself if your journey isn't unfolding the way you think it should. Know that it is what it's supposed to be to make you be a strong nurse who can provide that excellent care to your patients and keep them safe and learn to critically think through things. It's a process. So allow yourself that freedom to grow in that way, and to, if you have to come back and repeat the course, come back with a positive attitude and get the most out of it that you can. So that's my wish is for all of you to pass it the first time and have mastered it the first time. That would be ideal. I'd love that. So any other thoughts or questions before we wrap it up? All right. Well, if you don't have any more questions for me, I'm going to stop the recording.